There are two main benefits for oncoplastic surgery. Benefit number one will be oncologic surgical outcome. In particular, re-excision rate will be significantly lower because we're able to take bigger margins of normal tissue. So my personal review of records show that unless the patient has tumor spanning greater than 5 centimeters in size, the re-excision rate for that group of patients is less than 1%, which is a lot less than average lumpectomy re-excision rate that approaches around 20%. But for patients who have a lot bigger tumor, even greater than 5 centimeters in size, we are sometimes able to save the breast by doing oncoplastic surgery. Number two is, well, we mentioned earlier, sometimes we can save the breast if the patient feels that that is beneficial for their quality of life and if that's what they're looking for. So that can be one of the main difference in the quality of life from having breast versus no breast. From referring physician's standpoint, it is hard to know who would benefit from oncoplastic surgery. So I would say if the patient is a candidate for a lumpectomy and they have desire to change to a smaller size or be more lifted as part of this operation, then the patient may be a good candidate for an oncoplastic procedure. Having said that, the breast surgeon and the plastic surgeon together will have to evaluate the patient and find out more about the patient and what they desire and what they're looking for in order to make a final decision about the surgery.
The incisions that are used for oncoplastic breast surgery vary a little bit based on the patient's breast shape, size, the position of their nipple, the position of the breast tumor, and the overall size of the tumor. However, most patients will end up with a periareolar incision or a scar that goes circumferential around the areola. And then depending on those factors, patients may also end up with an incision pattern that has a vertical line that goes from the inferior portion or the bottom portion of the areola down to the breast fold. And then some patients will additionally have an incision along the breast fold or the inframammary fold or IMF.
There are a few downsides of having oncoplastic surgery. Because it is surgery and it is done on top of cancer removal, it is a bigger surgery than a regular lumpectomy. Regular lumpectomy will have shorter incision length and won't change the breast as much, and the recovery time is faster. But for oncoplastic surgery, because we have to remodel and reshape the breast on both sides, the incisions will be on both sides and they will be longer. So patients will have to be okay with having a bigger surgery and longer incision. They have to be prepared for that so they are not surprised at the end of the surgery.
Oncoplastic breast surgery is a really common way that we treat breast cancer for patients, and it's something that we do on a weekly basis here.